Thank you for joining us today.
Morning, Doc.
Hello, good morning.
Right, Doc, so first of all, can you explain the function and purpose and why it is that we should keep track of our blood pressure?
Okay, good morning, everyone. First of all, we have to track our blood pressures because it will help us to manage our risk factors. Because we know that hypertension or high blood pressure, it's a silent killer, and it could affect and threaten our health, yeah, and of course makes an increase and damage in our important organs, yeah, such as brain, eyes, heart, kidney, and others, yeah.
What are some of the, what is the range of a healthy blood pressure on the low end, both on the low end and on the high end?
Okay. The range of a healthy or normal blood pressures, based on our newest guidelines, International Society of Hypertension on 2020, it's recommended below the 130/85 of millimeters of mercury.
130 and 85. Okay. Well, doctor, according to the Journal of Hypertension, among people aged 18 to 39 years old, approximately 20% of men and 15% of women have been diagnosed with hypertension, with an expected increase in prevalence due to high obesity rates. So what are the causes of hypertension, especially among young adults nowadays?
Okay. As mentioned before, the journal that mentioned, if I'm not mistaken, it was a study that conducted in Wisconsin. Yeah, it's conducted from the overall about 15,000 patients, and among the 40 patients of young adults, it has 60% male, as mentioned before, and based on the result of the study, the most of risk factors that have been found on the young adults is current tobacco users and a higher BMI if compared with the older age, more than 40 years. But however, the young adults is still have a consistent prevalence if we compare with the older adults, just like more than middle age more than 40 years or older more than 60 years.
Right, but what about in Indonesia now? Because I know personally there is one case of someone who's younger than me. He's actually my little brother, Doc. He's 35 and he does have high blood pressure. And if I conclude from my own observation, it's because of lifestyle. So what kind of lifestyle exactly contributes to young adults or, relatively young adults having high blood pressure?
Yeah, okay. Apparently now there are many of young adults that have a hypertension, right? The risk factor for hypertension, we can make it to be two part, modifiable and non-modifiable risk factors. The non-modifiable risk factors, such as age, such as race, such as a family history, of course, it will make a higher risk for have hypertension. And for the modifiable risk factors, such as lifestyle, of course, first of all, we have to evaluate our lifestyle. Being overweight or obese, not physically active, more to sedentary lifestyle, use of tobacco, drinking too much alcohol, and don't forget how to manage the stress, And of course, certain chronic condition also can increase the risk of high blood pressure, including the kidney problems, maybe if having diabetes problems also, and sleep disorders.
I'm curious about that one thing you mentioned, which is stress, because in my family, we do have a history of high blood pressure, but only on the men's side. And it got me to thinking a lot as to perhaps are men leading more stressful lives at jobs back then when my dad was working, my mom was staying at home with the family, or are we just not taking care of ourselves as well as the women in our household, which actually makes sense as well. What is it about stress that causes hypertension? Because everything else you mentioned is food we intake or the lifestyle we lead or alcohol. That could directly physically affect us. But how does mental stress affect us physically that way?
Okay, yeah, of course, stress, it has to be manageable, yeah. Stress could be defined as physical stress or mental stress, as you've mentioned before. It will affect our metabolism and it will make our pressures, yeah, of course, yeah, in our arterial wall, yeah, the pressures in the artery makes the blood pressures, and becomes higher, and it will be disturbed, yeah, and it will make a risk for high blood pressure and trends to be hypertension, and then trends to be another of health problems or complications.
Yeah, it's scary. We don't.
If it's not treated manageable, yeah.
Yeah, we don't tend to think like, oh yeah, I'm busy at work, I'm stressed out, that
Yeah.
it can affect you physically as well, but obviously it
Absolutely.
can. Now, when it comes to age, Doc, what does it mean for young adults that have hypertension? Are they at a lower risk of perhaps correcting their course? Like, could they get out of it or fix their blood pressure a little bit easier than someone who's perhaps of an advanced age?
Okay, actually, for the young age, the younger hypertension patient, yeah, how we manage they are the same as the older patient, yeah. First of all, above the prescribed medication, we have to fix our healthy or modify our lifestyle, yeah, and of course to evaluate another risk factors, yeah. The same problems will face, yeah, with the same older patient actually, yeah. Not there are no difference significance between how to manage the younger adults or the older adults, yeah. But if the younger adults already have a hypertension, it seems like a lot of data shows that there's also increase in early organ damage, yeah, if we compare to older, yeah, or than we supposed to be, yeah. So it makes an earlier complication, an earlier damage of our important organs, yeah, if we compare with others that not have any hypertension.
Oh, scary.
What's your take on plant-based diet in solving hypertension, Doc? Because I'm currently reading this book titled How Not to Die. It's by Dr. Michael Greger, I think. And he really suggests that by modifying what you eat, by eating less animal protein, I mean, it's like, yes, you can be flexitarian, but by bulking up your diet with fruits and veg, actually it does good to your body. You will stay alive longer, you know? What's your take on that, doctor?
Okay, a diet, of course, it includes in our program to be modified. We should eat a healthy diet. We should choose a healthy meal and snack option, and really make sure and be sure to eat plenty of fresh fruits and vegetables, yeah. As recommended from the guidelines, yeah, we have to eat more of fibers, yeah, less of natrium, and of course manage the others of these factors, yeah.
Right. Doc, so apart from, because we have a little device at home that we use, a home blood pressure kit.
Yes.
We can take it in a couple of minutes and it'll give us a reading. However, apart from doing that on a regular basis, what should we look out for any symptoms perhaps that might lead to hypertension for young adults especially?
Okay. Unfortunately, hypertension is also called a silent killer. Yeah, most of the patients did not have any symptoms or unaware about the problems. Yeah, because of no warning sign and the symptoms at all. But sometimes a few people with high blood pressures may have such a headache, nosebleed, maybe shortness of breath. But these signs also did not actually aren't specific, yeah, for only hypertension, and usually it did not occur. It did not happen until your blood pressure or high blood pressure has reached a severe or a life-threatening stage. So it is really essential that your blood pressure should be measured regularly because the measurement of your blood pressure is the only way to us know whether we have had a hypertension, a normal blood pressure or not.
Right. I think,
We're
and I think,
doing-
yeah, we're doing the right thing there, right? Just get yourself one of those. They're not expensive. You can just buy a
Yes.
home kit.
Yeah.
And my advice would be do it regularly so you can see where your baseline is approximately, so you know whether it's a little bit on the higher end or a bit on the lower end. And do it first thing in the morning before you have your coffee or anything like that, so nothing is affecting your baseline blood pressure there.
Yeah.
So how can we prevent hypertension happening to younger humans then? I mean, happening earlier than before?
If we see the data from the journal as mentioned before, it states that most of the younger adults have a hypertension and have a higher BMI, obesity, and use of tobacco. If we compare to older, but above the two of the risk factors, of course, how to prevent the high blood pressure or how to manage our blood pressure is first we have to maintain our healthy lifestyle, healthy diet, healthy weight, our BMI should be ideal. Manage our stress and don't forget to manage also your sleep. Get your enough sleep.
Right. Lastly, before we go, let's not to scare our viewers, but what can happen if you don't? What can uncontrolled blood pressure lead to, Doc?
Okay, uncontrolled blood pressure. Of course, first, it will affect our hemodynamically. It will affect our metabolism. It will make disturbance in our blood sugar also. And it will make a lot of complication. The excessive pressure on our artery wall, it could cause the damage in our blood vessels as well as your other organs. The higher blood pressures and the longer it goes uncontrolled, it will be the greater the damage. Among the other complications, hypertension can cause a serious problems and damage on the heart. The excessive pressure will make and reduce the blood flow to the heart and could cause angina, could cause chest pain, heart attack. It could also cause heart failure and irregular heart rhythm problems that could trend to a sudden death. Don't forget, hypertension also could make a block or a burst in the artery that supply our brain, and it could make some stroke. Hypertension also could make our vision loss. Hypertension also make our kidney problems, kidney damage that will leading to our kidney failure. And hypertension, as I've mentioned before, of course, could make problems in metabolic. And that kind of problems, of course, will make a higher risk for another complication, such as mentioned before.
Wow, such a long list. Of
I
things
don't
that
look
can
forward
happen.
to that.
Yes,
Not at
definitely.
all.
So we need to keep track, make
Yes.
sure we're in good health. Doc, thank you so much for your time this morning. So we know what to look out for when it comes to our blood pressure. We really do appreciate your insight on this. Have yourself a great day.
Thank you, Doc.
Thank you. It's my pleasure.
Stay safe always.